Hi everybody, this is Dr. A.V. Arun from BDS or Bald Dental Speaks, the channel for news, views and interviews on everything you need to know about dentistry and how to keep your teeth healthy. As we age, we become more susceptible to infections, diseases and medical complications. Most of these need tablets or medications to treat them. Now, these medications could be sometimes just for a couple of days, 2 or 3 days, or sometimes maybe a little longer duration, like a month or two, or sometimes they could be lifelong also. Now, these medications are very essential for treating certain diseases and certain medical conditions, but they could have some drawbacks also. And these drawbacks can be shown, complications can happen in the mouth, though the mouth is not related directly to the disease. So today I'm going to speak to you basically about some side effects of medications which are used for treating certain conditions. The most common complication you get due to taking tablets over a period of time is dry mouth. Now, according to scientific data, almost 350 to 400 medications can actually cause this dry mouth condition in your mouth. And dry mouth does decrease salivary secretion. This can come due to antihistamines or medication which you take for allergies. It could be because of antidepressants which are taken, or it could be due to BP and cardiac drugs. Now, what these drugs do, it suppresses the formation of saliva in the mouth. This can lead to other complications. I mean, the salivary secretion is less. The teeth don't get cleaned properly, food accumulates here and there, and they are more prone to cavities than a normal person. Also, you have other complications like bad smell coming. So gums start getting inflamed. So these are complications which are coming from dry mouth. Now there are various ways of treating dry mouth. I'll come to that separately. Another complication which happens due to taking a lot of drugs is teeth staining. Now this teeth staining can either be permanent teeth staining, or it could be something which happens externally, and once you do a proper cleaning, teeth become white again. Now, if you take drugs like tetracycline, which is an antibiotic which was very commonly used earlier, this tetracycline, if the mother is pregnant and she takes it, or the child is very young and the teeth are still in the formative state, the teeth start becoming brown. I can see stained almost brown in color. And this is a common feature with people when this antibiotic has been given. And so mostly because of this, that antibiotic is replaced by penicillin and other lot of antibiotics which do not cause stains. Also, if you have something like iron supplements which you keep taking regularly, these can also cause stains on the teeth. But good for you, these stains are external. They have blackish color stains which happen, and these stains can be cleared by doing a proper cleaning. And the final application I'm going to come to you, which is very important when you're going for any dental treatment, is uncontrolled bleeding. Now, bleeding gums happens often, but uncontrolled bleeding happens when you are taking certain cardiac drugs called blood thinners. Anytime you go to forget a dentist, any doctor for that matter, you first have to inform them that you're taking blood thinners, because even a small incision will lead to bleeding, and this bleeding cannot be stopped that easily. There are many times that the patient has to get admitted in the hospital, to stop the bleeding, where they get blood transfusion and all these things. So when a person comes, when the person is taking these blood thinners, the chances of bleeding becomes very, very high. Bleeding does happen. The biggest problem is you cannot control or stop this bleeding, because the blood thinners, they remove the clotting factors from the blood. So in case any treatment is to be done for these patients, you need to stop the blood thinners for at least 3 days, and on the 4th day you can start the treatment, which would involve bleeding. And once the treatment is over, probably a day later, you can start them with the blood thinners again. And finally, the fourth complication I'm going to talk to you about is swollen gums. Now, this swollen gums condition comes especially for patients of epilepsy who are taking a drug which is used to control epilepsy. Unfortunately, this drug also leads to swollen gums, and this swelling is really, huge. It looks very unaesthetic, and maintenance of hygiene is also very difficult because when the gums are swollen, you can't brush properly or clean properly. There's a lot of food accumulation and bad odor coming. So when you have these patients, now these epileptic patients cannot stop the drugs which they are taking. Okay, this is only a side effect. So what we do is the patient comes to us. Sometimes we need to do a small gum surgery, reshape the gums, remove all the extra gums which is there, so that the gums and the teeth look healthy again, and the patient can actually brush and clean properly and will look aesthetic. Unfortunately, as long as he's taking the medication, this keeps repeating again. But we can solve the problem by doing the surgery once in a while. There are a lot more complications which are there, but I'm sticking to just these four. Please subscribe to my channel. It's a new channel. We don't have too many subscribers, and it will really help if you subscribe to us. And I'll be coming back to you with a lot of tips and tricks on dentistry and how to solve your dental problems. Thank you so much.